all about You Are What You Eat with Dr. Mike. Of course, we've talked throughout the show about omegas, vitamin D3, and probiotics. We want to wrap this all together because it's important to say you have to take this, you have to take this, you have to take this, but people want to know, does it work? And you're here to say, yes, it does work, and you've got some prime examples with some of your patients. But specifically with allergies and sensitivities and intolerances, how are all of these ingredients or supplementations, how do they work together?
Well, first and foremost, you know, I have a practice and I do treat patients using natural medicine. So what I don't want to do is overwhelm my patients with taking so many supplements for no reason.
Right.
So first of all, A, if it's not going to work, I don't want to recommend it. And B, I want to make sure what I'm recommending is actually right for them. So I do a lot of testing in my office, and so this is an example of how we actually saw a patient, and a mom came in, of course, complaining. You know, her daughter had severe eczema, atopic dermatitis throughout her entire body, and her mother says, you know, we're done. We've done everything. We've exhausted all our options. You're our last resort. Can you help? And at that point, instead of just giving supplements and providing stuff, I mean, they've done everything. So let's try to do something that they haven't done. And it was a blood test.
Okay. And so we'll bring up the results of that blood test. What did that blood test tell you?
Well, first and foremost, it's a food allergy and sensitivity blood test. So this test here is called an IgE, IgG, and an IgA food sensitivity panel. So what that means is we're testing for allergies, and that's the IgE category, and that's the black line. You don't see any now, but you'll see some later. And then also is the IgG, which you'll see is extremely elevated in this particular blood. And so IgG is a sensitivity. So it's not an allergy, but it's a sensitivity. What that means is that if you consume something in that category, for example, this patient, dairy, she's in a type 6, so hypersensitivity type 6, if you see on the bottom, it's extremely high. She's in the red. If she's consuming it, that means it's going to harm her. It may not harm her today, but it may harm her tomorrow or the day after or the week after. And so this escalates with these little angels here. And in terms of that, that's when we can sort of eliminate these foods. So these are called offending foods. So see, in this category, dairy is offending this patient. It's causing her body to react. Her immune system is reacting. So how can we use some of the things we spoke about today to modulate the immune system so that it's not reacting? So first and foremost, vitamin D3 is going to be crucial here because it's going to help the gut, because the gut was the most important thing that actually took the hit.
That's the center of our immune system, like
exactly.
you said. So
that's going to heal. Secondly, you want to use a fish oil because that's going to heal the skin and decrease the inflammation. And of course, excoriated eczema means scratching. So this child was scratching in her sleep to the point that her mom was putting these thick mittens on and had to tie them on, but she would still rip them off and scratch. So she would be bleeding and it would be red and puffy and inflamed. So of course the fish oil will help mitigate that inflammation. Secondly, a probiotic will now also help with the immune system and helping with the gut and reestablishing this gut flora. So 3 things: eliminate the food, replace some of the probiotics that are missing, and add some vitamin D3. This was one of the products that were instrumental in this case. I mean, if you show, I guess we'll get to the clip of the before and after. So what we did is in 4 weeks, she eliminated all those foods that were potentially allergic to or had a sensitivity to. It just so happened we caught some allergies as well. So she was severely allergic to honey. You didn't see it in the chart, but we eliminated all these foods. We gave her a dose of this product right here, which is designed for skin. It's a brilliant product. And we also gave a probiotic in conjunction with this. And lo and behold, after 4 weeks, we saw a huge, significant difference in about 50%.
All right, let's take a look at that picture. So this is eczema. It's a skin condition. And a lot of people wouldn't think to treat a skin condition with, you know, vitamin D, omegas, and probiotics, because you think of it as topical. But you can see in that first shot,
so you
red,
yeah, the top picture is when she first came into my office. And after 4 weeks of just eliminating the offending foods and supplementing with a probiotic and the Ascenta skin product that we mentioned here, her skin got significantly better. And she's doing, I mean, this was months ago, so she's doing tremendously better. In fact, the parents are just, you know, obviously for reasons of her daughter doing well, I see her every 4 to 5 months. So she's doing significantly better. They're really happy, but it's still going to take a while for her skin to start healing. So she still needs to be on the product for a while.
Okay, and that's this product specifically that you're talking about?
That was this product that was geared for skin. So it has a high EPA content in a 3-to-1 ratio. It also has a DHA content, so so a high DHA but higher EPA for inflammation. But it also has the zeaxanthin, which is an antioxidant, vitamin D3, and a GLA, which is extremely important for regenerating skin cells. So that's why it got the health claim for helping skin conditions. But I don't just use it for skin. I mean, I use it for any kind of inflammatory conditions.
And that's one that it's taken orally, just like a fish oil?
Yeah, this is taking orally, 1 teaspoon a day.
Okay.
Will give you about 1,300 milligrams of combined EPA DHA.
And you've avoided using a cortisone cream or
that's the
a
idea.
topical
lotion.
Exactly.
That's the idea. The parents didn't want to use any more cortisone and corticosteroids because they just said, you know what, there's no point. We're using it. It's not helping anymore to that extent. So to the point that she had to go down and get some injections. So in this particular product, this was it's a little girl. She's 6 years old. Of course, I'm a dad, and I'm a little sensitive when these little sweethearts come into the office. And we want to try to help, make it easier for them. So I don't want to give her 5 different supplements. I gave her this supplement because it was a multifunctional supplement in that it had a GLA, EPA, DHA, but it also had 1,000 IUs of vitamin D3 per serving. So based on that, it was just one quick dose a day, twice a day. And then she was on her way.
Sounds good.
And then with a probiotic that I know she was going to take, so it had to taste good, but it couldn't have any dairy in it. So based on that, obviously with the sensitivity, I had to get a dairy-free probiotic and reestablish the gut flora, and her digestion was improved.